Fingerprints, with their unique ridge patterns, can reveal insights beyond their use in personal identification. Here's what various types of fingerprint patterns might indicate about your personality or characteristics. Types of fingerprint patterns and their traits. Loop patterns. Ulnar loop, which slopes toward the little finger. Personality traits, usually calm, adaptable, and good at going with the flow, often sociable and cooperative. Radial loop. These patterns slope towards the thumb. Individuals with radial loops are often independent thinkers and tend to be unconventional. They are less common and are generally seen as creative and individualistic. Whorl patterns. Plain whorl. People with this pattern exhibit personality traits such as determination, ambition, and sometimes stubbornness. They are typically methodical and have a preference for routine. Central pocket loop. Whorl personality traits include being resourceful, with a strong sense of purpose. These individuals are good problem solvers who think analytically. Double loop whorl personality traits are quite complex, often dealing with conflicting desires or tendencies. They can adapt well to changing circumstances. Accidental whorl personality traits are unique, inventive, and often eccentric. They tend to have a distinctive outlook on life. Arch patterns. Plain arch, personality traits, practical, down-to-earth, and often cautious, typically reliable and straightforward. Tented arch, personality traits, more intense and passionate. They may experience sudden changes in interests or pursuits. General interpretations, loops. The most common pattern, often associated with easygoing, adaptable, and flexible individuals. Whorls tend to indicate a more complex personality, often with leadership qualities and a strong sense of individuality. Arches indicate a straightforward, no-nonsense approach to life with a practical and sometimes conservative mindset. Scientific considerations. Genetics. Your fingerprint pattern is largely determined by genetic factors. The exact pattern formation is influenced during fetal development and is unique to each individual. Dermatoglyphics. The study of the ridge patterns of the skin, particularly on fingers and hands, used in both scientific research and personal profiling. Psychological and behavioral studies. Though some psychologists and researchers have tried to correlate fingerprint patterns with personality traits, these associations should be taken with caution. There is limited empirical evidence to support strong personality correlations based on fingerprint patterns alone. Practical uses of fingerprints are vast and varied. Identification is the most common use, as fingerprints are primarily used for personal identification due to their uniqueness. Interestingly, in some cases, certain fingerprint patterns have been linked to genetic disorders or syndromes, aiding in medical diagnostics. Medical applications of fingerprint analysis are quite fascinating. By studying these unique patterns, researchers and medical professionals can gain insights into various health conditions and genetic predispositions. Genetic disorders can sometimes be detected through fingerprint analysis. Specific patterns in fingerprints have been associated with certain genetic conditions, providing valuable information for early diagnosis and intervention. Down syndrome. Characteristic patterns, often associated with a high frequency of ulnar loops, a single transverse palmar crease, also known as a simian crease, and specific ridge counts. Diagnostic value fingerprint patterns in Down syndrome patients typically show a distinctive pattern that can aid in early diagnosis or in conjunction with other tests. Turner syndrome. Characteristic patterns frequently exhibit increased arch patterns and decreased total ridge count. Diagnostic value dermatoglyphic analysis can support other diagnostic tests in identifying Turner syndrome. Klinefelter syndrome. Characteristic patterns often have fewer loops and an increased number of whorls. Diagnostic value. These patterns, in combination with other symptoms and tests, can help in diagnosing Klinefelter syndrome. Rubinstein-Taybi syndrome. This condition is known for broad thumbs and toes along with unique dermatoglyphic patterns such as increased arches and unusual loops. The fingerprint patterns can provide diagnostic clues alongside genetic testing. Neurofibromatosis. Individuals with this condition may exhibit atypical palmar patterns, including increased loops and arches. These unusual dermatoglyphic findings can be suggestive of the condition and aid in its clinical diagnosis. Chromosomal abnormalities. Patau syndrome, also known as trisomy 13. Characteristic patterns for this condition tend to show fewer and simpler ridge patterns compared to the general population. This can have diagnostic value as it can complement chromosomal analysis in diagnosing this condition. Edwards syndrome, or trisomy 18. Characteristic patterns here include an increased frequency of arch patterns and decreased ridge counts. This supports other diagnostic criteria for this syndrome. Cri-du-Chat syndrome. Characteristic patterns for this syndrome show a high incidence of arch patterns and a reduced total ridge count. Dermatoglyphic analysis can provide additional diagnostic information in these cases. Developmental disorders. Autism spectrum disorder, also known as ASD. Research indicates variations in fingerprint ridge counts and patterns among individuals with ASD, though findings are not definitive. Patterns may be used in research contexts rather than as a primary diagnostic tool. Attention deficit hyperactivity disorder, commonly referred to as ADHD. Some studies suggest differences in ridge counts and pattern formations in individuals with ADHD. This is more often a subject of academic research rather than clinical practice. Congenital heart diseases. Certain congenital heart diseases have been linked to distinct dermatoglyphic anomalies, such as increased loop frequencies or abnormal ridge patterns. These patterns can be part of a broader diagnostic approach to identifying congenital heart anomalies. Metabolic and neurological disorders. Diabetes mellitus. Some studies have noted specific dermatoglyphic trends in individuals with diabetes, such as a higher frequency of ulnar loops. While these patterns could provide supplementary diagnostic information, they are not a primary diagnostic tool. Epilepsy. Research suggests variations in dermatoglyphic patterns among individuals with epilepsy. It's interesting to note that while these patterns can be useful in research, they are not a definitive diagnostic measure. Prenatal and early childhood screening. Fetal alcohol syndrome. Characteristic patterns include distinctive fingerprint patterns such as altered ridge counts and configurations. Dermatoglyphic analysis can support other diagnostic methods in identifying fetal alcohol syndrome. Nutritional deficiencies. Characteristic patterns. Variations in dermatoglyphics have been studied in populations with specific nutritional deficiencies. Diagnostic value can aid in understanding the impact of nutritional deficiencies on fetal development. Scientific basis. Fingerprints develop between the 10th and 24th weeks of gestation, influenced by genetic and environmental factors. The correlation between dermatoglyphic patterns and genetic disorders is based on the influence of genetic factors on both the development of fingerprints and the manifestation of certain conditions. Research and clinical use. Dermatoglyphics can be a non-invasive screening tool to identify individuals at risk of certain conditions, often used in conjunction with genetic tests, medical history, and clinical examinations to provide a comprehensive diagnostic picture. Limitations. Dermatoglyphic patterns alone cannot diagnose conditions but can provide supporting information. The patterns can vary widely even among individuals with the same condition, making it essential to use them alongside other diagnostic methods. The study of fingerprints and dermatoglyphics in medical diagnostics bridges the gap between genetics and clinical observations, providing a useful but supplementary tool for understanding and diagnosing certain medical conditions and genetic disorders. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more fascinating insights. Disclaimer: this video is for informational purposes only and should not be used as a substitute for professional medical advice.